Um, so guys, today we are going to study about the right atrium. Okay, right atrium under 4 headings. First will be your external features, internal features, your development, and its blood supply. So guys, before going into these features, let me briefly tell you about the position of the right atrium. Right atrium, okay, with respect to body surface, or you can say thorax, and in the heart. Okay, so this is your, you can consider this your heart. This whole thing is your heart. Okay, and it is divided into 2 halves, the right half, left half. Okay, this is again subdivided into upper and lower. So uppers are your atriums, lowers are your ventricles. Right side is the right atrium, left side is your left atrium. This is your right ventricle, this is your left ventricle. So here you can see that your right atrium is the upper lobe. Okay, it is forming the upper chamber of the heart, right? Upper chamber of the heart. And this right atrium, it receives blood. Okay, it receives blood from the different parts of the body through 2 systems which open to that, like major systems. This is your superior vena cava, this is your inferior vena cava. Okay, so let me tell you about the borders of this heart. Okay, so here you will have this whole area is your superior border. Okay, this is your inferior border. This is your left border. This whole thing is your right border. So you can see this right atrium, it is making 2 borders, like your right border, part of your right border, and part of your superior border. So you can see a right border as well as superior or upper border. Okay, and I'll tell you one more thing. It is forming the base of the heart. Like consider this is a glass, right? Normal, what you drink, water, right? So this surface is forming the base of this whole glass of water. Okay, with this surface. So similarly, your right atrium will form the base of this whole heart, complete heart. Okay, so the complete heart rests on this right atrium. Okay, and it also forms the sternocostal surface along with the right atrium. So if this is your heart, okay, this is your right atrium, this is your left atrium. These are like your anterior parts. Okay, and you can see this is, I'll draw it a little smaller so you can understand this is the posterior. Okay, so like this. So here, if I just draw ribs, like this is your mammalian body, and this. So this is like this kind of your ribs. Okay, I'm just trying to show it like random diagram. So I just want to say that this your left atrium as well as your right atrium right atrium and your right ventricle, these both are facing anteriorly. Okay, like this is the right atrium, right ventricle. So this will face the your sternum as well as your ribs. Okay, so that's what I want to say. So it also forms here sternocostal surface. Sternocostal surface. Okay. Even the right ventricle forms the surface, because right ventricle and your right atrium both are facing anteriorly. So anteriorly is your sternum and your ribs, right? So sternal costal surface. So let us start with the external features. Okay, your external features. Okay, so we are going to see the heart from the outside. Okay, we are going to see the heart from the outside. So consider this is your right atrium. I'm just showing you the anterior view. Okay. This is your right ventricle. Okay. This is your left ventricle. And here is your, this is posterior. Mostly, I mean, you can't see the left atrium from the anterior view. Just I'm showing you, like it's a posterior view. Okay, this is your, this whole is your right atrium. Right atrium. This is your right ventricle. This is your left atrium, left ventricle. This is your anterior view. In the anterior view, you can only see this portion. Okay. So anteriorly, you can see most of the right atrium, your right ventricle, and your part of the left ventricle. Okay. And as you can see, this is forming the right border. I told you, right? The right border. This is your upper border and your left border and your inferior or lower border. Inferior border. So you can see this right atrium is forming the inferior border. Okay. And your left ventricle is forming just mostly the left border. So here I want to tell you that what are the structures which open in the right atrium. Okay, you can see externally. So here, okay, let's take out this just right atrium and right ventricle. Okay, in the side picture I'll just show you separately. So this is your So let me divide this whole right atrium into two parts. Okay, like this. So this will become your upper part. This will become your lower part. So in the upper part, you have an opening of superior vena cava. Superior vena cava drains like most of the blood from the upper part of body. Okay. And in the lower part, you will have inferior vena cava. In the lower, you have inferior vena cava. Okay. And it will drain blood from most of the lower part of the body. Okay, and as we are seeing externally, there's a ridge. This between the right atrium and your right ventricle, there's a ridge. This thing, okay, is known as his atrium, this ventricle, right? So atrioventricular sulcus. Atrioventricular sulcus. Okay, in which your right coronary artery is lodged. Your right coronary artery will later learn it will supply the right part of the right atrium. Sorry, it supplies the right atrium, and it also supplies the part of the left ventricle. I mean, other parts of the heart too. We will see that in detail. And next, this is your superior vena cava, inferior vena cava, and from here you will have a externally we are seeing, right? Externally you will have a ridge, okay, that connects from superior vena cava to inferior vena cava. Okay, and on this ridge, okay, and this ridge like structures it, like it is basically like a sulcus. I will show you. You are seeing from the upper view. Okay, so you can see that this is like, it is like a sulcus. It is sulcus, and inside it is forming a ridge. Okay, this thing. So on this you will have, okay, this is your, like, hope you understand, trying to understand, this is your ridge, okay, and as it goes inward, okay, like inside, in from the interior of the right atrium, this hole is forming a, you can see, like elevated portion, like I was trying to show you, okay, like this is your sulcus, okay, it is depressed inside, and this thing will form a ridge, okay, like if you see from outside you will have sulcus, inside you will have ridge, okay. So in the sulcus, in the uppermost part you will have SA node, okay, on the external surface. So SA node is launched in the uppermost part of this sulcus. And what is this sulcus? This sulcus is known as sulcus terminalis. Okay, this sulcus is known as sulcus terminalis, and this ridge, which you can see, this is like if I divide this into two parts, so this is your like outer side, external feature, and internal of right atrium. Externally this is forming a ridge, like sulcus, that is sulcus terminalis, and inside this will form like a ridge, like I'll just show you. This is you're seeing from the external surface, so you can see this is your space, okay, like this kind of space. This is known as your sulcus terminalis, and this structure, these fingers are forming ridge-like structure. You can see ridge, right? This ridge, like here it is shallow and here it is raised. So this ridge is known as crista terminalis. It's known as crista terminalis. Okay, that ridge is known as crista terminalis. Yeah, and the other thing is that this left atrium, okay, it is raised, okay, you can see it is raised to cover the root of ascending aorta on the pulmonary trunk. So I'll just show you in this diagram. Okay, so from your left ventricle comes out your pulmonary trunk, and from your left ventricle comes out your arch of aorta. Okay, comes out your arch of aorta. Here is a root. Okay, like this. So this right atrium, it forms a raised structure that covers the little of the root of the pulmonary trunk, or you can say this root of pulmonary trunk as infundibulum, or you can say it like conus arteriosus. Okay, and it also, this raised structure also covers the little of root of aorta, root of ascending aorta. Yes, that is about the external surface of the right atrium. So I'll just tell you in short what are the tributaries or like structures that open in the right atrium. Okay, you have to tell me. It's like superior vena cava, your inferior vena cava. So there's coronary sinus. I didn't tell you about coronary sinus, right? Coronary sinus is the cardiac veins. Okay, like the veins of the heart that open into the right atrium. Okay, through a sinus. Like the opening is where these all veins open is known as sinus. Through that it drains into the right atrium. So coronary sinus, and like some small cardiac veins also open directly into your right atrium. Okay, so these are the structures which open in the right atrium. Yeah, and you have some sebaceous veins, and your vena cordis mini. These are also the veins which open into your right atrium. Guys, now let's see about the internal features of right atrium. Internal features. Okay, so this we'll study in the 3 headings. First you'll have posterior portion, then anterior, okay, and then intra-atrial septum. Atrial septum. Okay. So first we'll see about the smooth posterior portion. Smooth posterior. So the posterior part, okay, so let me show you. This is your right atrium. Okay, I'll just cut it half, like vertical section. Okay, I'm just cutting vertical section. Like if I cut out, okay, if I cut out it from this side, okay, this is your intra-atrial septum. Okay, I'm just slicing off this ventricle. So here, so this will be your, we are seeing about the internal feature. Okay, so this is your posterior part. Okay, and this is your anterior part. So and this is your intra-atrial septum. So first we'll study about posterior, then we'll study about the anterior, then we'll study about intra-atrial septum. Okay, because actually you'll have, normally this is your right atrium, left right ventricle, left atrium, left ventricle. So we are studying about this. We are just cutting off this ventricle like this. You can say what, like vertical section. You are making these 2 parts. Okay, like half will be anterior, half will be posterior, and we are opening like this. Okay, so this it will come like this in this portion. Okay, so what you see in posterior is here you will see the opening of superior vena cava and inferior vena cava. Okay, you see the opening of superior vena cava and inferior. Superior in the upper and inferior in the lower. And your superior vena cava, okay, superior vena cava opens in, and the inferior vena cava has valve. Okay, has a valve. Blood comes like this. Okay, into this through inferior vena cava. It has a valve. This valve known as eustachian valve. Eustachian valve. Okay, this valve is rudimentary in adult, but in children it guides the blood. Okay, the action of the blood from the here you will have a valve. Okay, it's directs the blood from right atrium to the left atrium, because at that time your lungs are not functional, right? Okay, because at that time the blood is cured, or you can say purified or filtered with the help of placenta. Okay, mother's placenta. So here this eustachian valve, it will direct the blood through your foramen ovale, okay, into your left atrium. This foramen ovale, in adult it is known as fossa valis, which is like normally closes off. Okay. And between your eustachian valve and here you have your tricuspid orifice. Okay, and here you have your tricuspid orifice through which the blood flows here. So here at this point you have something called coronary sinus. Okay, and this coronary sinus is this cardiac veins. Okay, the veins which supply the heart, large veins, they open here, and these veins open as a whole as coronary sinus, and these veins have a valve. Okay, these veins have a valve. This valve at the sinus known as Sebaceous valve. Or Sebaceous valve. Below this opening of the superior vena cava, you have some projection like this. That is known as intravenous tubercle of lower. Okay, in intraembryonic life, this helps the blood from superior vena cava, okay, to go into your right ventricle. It will be here, okay, from right atrium to the right ventricle. Yeah, next is the rough anterior part. Okay, so here you will have, I told you, right, in the anterior you have something called crista terminalis. Okay, from here you will have some muscles, okay, coming like this. Okay, so these muscles are known as musculi pectinate or pectinati. Okay, and these are generally the direction of, I will show you here. This direction is like, they are directed towards the orifice. Okay, so I will tell you, wait. This is your right, anterior of the right atrium, and this is the crista terminalis. These are directed like this, forward and towards your atrioventricular orifice, or you can say tricuspid orifice. Okay, this is your pectinate muscle. Okay, and here I told it's auricle, right? Here, this position, this muscles like form a network. Okay, reticular network at the auricle. Auricle, I told you, right? That covers the your root of your ascending aorta here, and your pulmonary trunk. That is part of pulmonary trunk. Origin of pulmonary trunk is conus arteriosus. So that place. That is about your rough muscular part. There is not much about the intra-atrial septum, but here you will have an orifice-like structure, okay, known as fossa ovalis. I told you, right? This thing was very important in your intrauterine life. It helps to direct the blood from your right atrium to your right ventricle, right atrium to your left atrium. Okay, and it is derived from the some septum primum and septum secundum. So right now let's see about the blood supply. Okay, supply. So the blood supply of the right atrium. Okay, right atrium. Here I told you, right, you have your arch of aorta. So you have your aorta coming from the left ventricle. So, and here I told you there is sulcus in groove, you can say, between atrium and ventricle. Okay, atrioventricular groove. So there is a artery. It is right coronary artery. Okay, so if I draw clearly, so this is your aorta, and there is an artery coming like this, and it passes through this groove of this atrioventricular groove, right atrioventricular groove. Okay, this is your right coronary artery coming from the root of ascending aorta. It also gives the left coronary artery. So right coronary artery supplies the whole of the right atrium. Guys, let's say about the development. Okay, so I told you, right, in 3 parts. Okay, so your posterior part develops from the right horn of sinus venosus. Okay, and your anterior part develops from the primitive atrial chamber. And your intralateral septum, it is derived from the septum primum, septum secundum, and septum secundum. Okay, so your posterior part from the right horn of the sinus venosus, your anterior part from your primitive atrium chamber, and your interatrial septum from septum primum, septum secundum. Okay, so that's it about your right atrium. Okay, we did under external features and internal features, blood supply and development. Any queries, please let us know in the comment box. Okay, thank you.